Well, hello and welcome. Technical glitch there. I didn't hear I was on there. Apparently, I am on there. But welcome to a beautiful week. And today we're looking at government's new policy on nurses. Now, see, once upon a time, there weren't that many nurses. And therefore, after you finish training, the government makes you sign a bond. And this was so that the government could post you to areas where you ordinarily wouldn't have chosen. But as time went on and education expanded and nursing became more flamboyant and even more boys became nurses, now there are so many nurses, government is saying, you know what? Now when you finish training, you're on your own, because now people are prepared to go to areas where in the past they wouldn't have wanted to go. So there's no need me bonding them. And then they all become unemployed nurses, and they're giving me grief and giving me headache. When you finish nursing, you're on your own. However, those who are being trained to be nurses are saying, now listen, we train to be nurses to serve God and country. After we become nurses, we can't be accountants, we can't be bankers, we can only be in the health facility. Government is the biggest employer when it comes to health. And therefore, the policy should be rather, whether you were trained by government or private, find a way of absorbing us, because instead of a 3-to-1 ratio, at the moment is about a 20-to-1 ratio, so there are more hands needed in the system. What's government saying? What are the nurses saying? My name is Nana Sakwa the Fourth, Akwamu Edumasa Henning, and also your host. When I come back, talking to both sides. Don't move. Well, hello and welcome. Thanks for staying. We're looking at government's new policy on training nurses. And with me in the studio is John Nketia, who's a PRO for Coalition of Unemployed Private Nurses. John, you're welcome.
Thank you very much.
John is unemployed. Normally, first timers, we charge them, unbantams, but John is unemployed. So we won't want to cut. And then I have in the studio Tony Goodman, who's PRO for Ministry of Health. So he will give us the reasoning behind the new policy, which is that once you finished your nursing, you take your CV and just like everybody out there, go out and find yourself a job. I mean, is this going to let the profession more interesting, or is it going to deter people knowing that you don't know what's at the end of the tunnel? But let me start with John. John, let me start with you. Now, you obviously are in a private, so you train privately.
Yes.
So once you finish, you don't have a bond with.
No.
You don't have a bond. But you're saying that there should be a policy that absorbs whether privately or government trained. Let me hear you.
Yes. Our issue is employment should be based on merit. And not as an issue of bonding trainees, you understand? Because our field is a specialized field where we cannot use our certificate to work in the banks or any other place apart from the hospitals and the clinics. And per the new policies sneaked in place, is not allowing private accredited trainees to be absorbed into the system, both from the facilities owned by the Ministry of Health and the Christian Health Association of Ghana, which comprises of the mission hospitals.
Well, Tony, this sneaked in policy, what's the reason behind it? And then,
thank you very much. Let me say good evening to our viewers. A policy over 2 or 3 decades ago cannot be sneaking. Yes, as you are aware, in the past we had a lot of attrition in the health sector where nurses and doctors leave the country for greener pasture. So based on that, the Ministry of Health introduced a policy which is if you are a nurse in nursing training, you are given some allowance. After the allowance, you are bonded. After training, you serve government for 5 years before, if you have to go further your education, you do that. If you have to travel elsewhere for any other job opportunity, after 5 years, you do that. You can agree with me that for this number of years, if you are implementing a policy, up to a point, you monitor, you evaluate, and you do some amends. So that is what has happened. We have a lot of nurses who are telling us that, why do you bond me for 5 good years after training? I want to further my education. I want to do something more specialized. So what government did was to introduce what we call the College of Nursing and Midwifery, where you can go and specialize in any other nursing field, be it pediatric, EMT, and other specialized programs. So quickly we have to now withdraw the bond from the system. And most nurses were happy with it because it now gave them the opportunity to further their education immediately they complete and start working. It is not also true that the bonding thing, because we've taken away bond, if you complete school, you will not have a job to do. No. Looking at the number of hospitals we are putting up, those we need to work with are the nurses. Look at range expansion projects. The 6 or 7 district hospitals we're putting up, the NMS projects, the number of polyclinics across the country, we need nurses to work in these facilities. So the bond doesn't mean that we are not going to give them a job. They are going to work in these facilities. And as I speak to you, about 5,000 people are currently being posted to various facilities across the country. Last year we did 11,000 and above. So we will continue to employ nurses. We will continue to employ health workers to work in those hospitals we are putting up across the country. So bond or no bond, there is a job for nurses.
So what's the apprehension, John?
I would like to know whether the job for the nurses, if you would be a little bit specific, does it include the private accredited trainees or it's only public trainees? That was what I want to know.
Yes, the 11,000 I mentioned, which took place last year, included the private and then the degree nurses. And you could
Private?
recall, yeah, private and degree nurses, most of them were part of the 11,000 last year. You recall that the then publicly trained nurses came out to chastise government. Now, why are you employing people who were trained privately? You bonded us, so why wouldn't you give us jobs? You are giving these people jobs. Give us jobs. So government promised that sooner than later they are also going to be employing. And then just recently we got clearance for them. So yes, we've employed privates in the past. We've also employed degree nurses in the past. The issue here, Anana, is the number of nurses we train in the public schools. Let's say in Kolebu, if Kolebu is training about 300 a year, private man will train about 500. Because you know they have to also generate money to run their facility. So if I'm employing 300 from publicly trained ones, and I'm employing the same 300 from out of the 500, obviously you have another 200 left. So we employ them, but we are also saying that they should also reduce the number of those training schools. Then all of them can also be employed. But as I speak to you, most of them were employed last year.
Tony, you know, the WHO regulations gives us the 3-to-1 ratio. Yeah. And currently we are doing 20-to-1. So what's this urgent need to slow down? Is it this IMF don't employ thing that's, you know, a tackle?
We are employing. So there is nothing like IMF in the health sector we are not employing. We are employing.
So there's so many nurses jumping up and down.
I know. That is why I just mentioned to you that we've employed 11,000. Currently, we are posting 5,000.
What happens to the rest?
Who are the rest?
I mean, there's so many. Let me let John come in.
I would like to know. He mentioned 11,000, and he said some of the private trainees were part of the posting, and he said currently they're about to post 5,000. The 5,000, does it also include the private accredited trainees, or it is solely for the public trainees?
After the posting of these 5,000 nurses, our next clearance we've also requested for from the Ministry of Finance include the private and then the degree nurses, which we are also waiting fervently to get for us to start posting them. So, you see, we are talking about posting. What are we talking about? We're talking about money. It is the Ministry of Health budget, what we call our emolument, that aspect of the budget, which says that you can employ this number of people within a year. That is what we use in paying. So if in my budget I am supposed to be employing about 1,000 people and I end up employing 3,000, it means that money which will be meant for medicines and other equipment and others will not be used in paying salaries. And they all go and then we sit. You and I will go to hospital, there will not be medicine to take care of us. There will not be equipment to take care of us. So if you are talking about employment, you are talking about money. What is the Ministry of Health budget for 2016? How many people are we supposed to recruit? Where are they supposed to be posted? Yes, we are doing that. Are we supposed to employ more than 3,000? No. So, you see, we send our budget, oh, we want to recruit this number. They look at your budget. So how much do you have there? Okay, now employ. Then we'll go ahead to employ. But if you come and then you say, oh, I was trained in a private school. I was also trained in a university. You have to recruit me. How do I pay? So we stagger it. We employ this number. Next year we take care of this group. Another time we take care of this group. That means that we are managing the health sector. If you are just bringing in people, money we are supposed to be using in buying medicine, you use that same medicine money in paying health workers, leaving the core mandate of the ministry, which is taking care of patients. That means that we are not managing the sector.
0560-800-000. Also, this is very technical, so all you nurses out there, join in this conversation. 0560-800-000. It's a WhatsApp line, so WhatsApp your messages and let's get talking. I have one nurse who sent a message saying that how do they even know that 11,000 people were posted?
How did they know?
How would they prove? Because the nursing fraternity.
But they are working. The only way you will know is they are working. As I speak to you, the 5,000, most of them were posted. From Kolebu, Konfanochi, Tamale Teaching Hospital, Chag, Ghana House, as I speak to you, most of them have been posted. They are receiving their postings. The next thing is they call you and say, where they've posted me, I don't want to go. Can you please help me to change and all that? So it's happening currently. You can tell you that. It's happening.
Let me come in this one. From what I know, I myself, I have been able to compile about 2,000 private accredited trainees nurses who are still in the house, who completed from the year 2013, and they are still in the house 2014. Myself, I completed 2014. Even 2012, we have some few of them. But the issue is, in the previous years, there was nothing like posting, giving priority to the public trainees and the private trainees. But, you know, in the previous years, when nurses were leaving the country, you know, to go outside for jobs, from my investigation, this is what I have found, that the government encouraged the citizens of this country who enroll in nursing with these allowances. And because of the allowances, that was where the bonding issues came in, where you, after training, because of the allowance that you are being given, you serve the country for 5 years, as Mr. Goodman said. And also, because in the government's bid to provide quality health service for all Ghanaians in this country, he encouraged the private sector's involvement in the training of private nurses for this country. And this led to the certification of private qualified institutions, you know, to be given the certificate to train these nurses. And that was when there is this program called Health Assistant Clinicals, HAC, was introduced to be run for 5 years to fill in the slopes, so that after the 5 years, they will introduce a new program for them, then the program will be off. But here is the case, because of the accreditations and the inauguration and opening of other institutions, a lot of schools who were already offering diploma started also doing the hack. And because the private sector were encouraged by the then government, to also partake in the training of the nurses, they also took part in the training of the hack trainees and the diploma nurses. So in the previous years, if you go to a public training institution and a private accredited institution by the National Accreditation Board and certified by the Ministry of Health, it is clearly stated here, and when I was enrolling in school, this was the form that I bought. If you should go to my school right now and take my file, this MOH form that is in. I was told that what you need is to pass your licensing exams. So far as the school is accredited by National Accreditation Board and the Ministry of Health, you'll be employed. And this was what I was showed. And it is here, if I'll be permitted to read.
Briefly, if
yeah. Is that there are a number of public and private institutions which offer training in various fields of health. The Ministry of Health employs graduates from private accredited health training institutions.
Ministry of Health employs?
Yes. And this is MOH application brochure and form when you want to enroll in a nursing institution. And the private accredited institutions are listed below. And per the forms that were sold in the year 2015 that myself and those private accredited trainees in the house bought, this was what was written on it. For trainees from the Ministry of Health and Ministry of Health accredited health training institutions. This was why I said that the policy is a sneak policy. Because on the form that we bought, it is clearly stated on it that for Ministry of Health institutions and Ministry of Health accredited health training institutions. But here was the case that when the final posting came, we weren't part. I was part of the team that went to the Ministry of Health and the Christian Health Association of Ghana to confirm whether we were part of the posting or not. This was what we were told when we went to the Christian Health Association of Ghana's office, the HR. He told us that we are not part of the posting. Why? Because private accredited trainees weren't given financial clearance. What is financial clearance? In the previous years, you hear trainees who complete school, work for a year, then they'll complain that their pay is not coming. So here was the case that in order to arrest that issue, what they introduced was you wait when your financial clearance comes, then you will be posted. Hence, when you start work, your money, your salary will be coming. But here is the case, we weren't giving financial clearance. And it is not only the Ministry of Health, of which Ghana Health Service falls under. It's not only that institution that employs nurses. We have the Ghana Health Service, which is under the Ministry of Health. We have the Christian Health Association of Ghana, which is called CHAG, which comprises of the mission hospitals and clinics and the teaching hospitals. The CHAG, or the Christian Health Association of Ghana, is not owned by the government.
It's under the Ministry of Health.
Yes, it is under the Ministry of Health. And per whatever bond that the public trainees have with the government, it's not with CHAG. But here's the case, because we weren't given the financial clearance. Institutions like CHAG, which are the mission hospitals and clinics, couldn't absorb it because of we not being given the financial clearance. Here being the case, the public trainees are being posted to the Ghana Health Service facilities and the Christian Health Association's facilities. And per the figures that Mr. Goodman is giving, the 5,000, I believe it doesn't include private accredited trainees. From all that posting that I have seen, the last part one that I saw was the posted public trainees to the Ghana Health Service was 1,131 and 1,000 and over into the Christian Health Association of Ghana. But here is the case that private accredited trainees are left in their house to deteriorate with their vulnerable knowledge and skills, whilst we are also citizens of this country, and we just found ourselves just because we didn't get the opportunity, to enroll in the public institutes, not because we don't qualify at that sector, but just because, the public institution can't absorb all of us. That was why the government, has given other private people the accredited and certified certificates for them to train nurses.
Okay, let me take a quick break here, and then when I come back, we'll go to Tony to get our answers. Don't move. Well, Thank you very much for staying. And just before the break, I think the big question was that, and joining us via WhatsApp is Beatrice Ajay Prempe, who's joining the show strictly via WhatsApp. And she wants to know that, why, I would like to know why the forms for national posting is sold to us, but when it comes to posting, we are excluded. Big question. But then there's so much on WhatsApp, and I need to catch up a little bit on WhatsApp before I go to Tony. 0560 800 000. Nana, how long can we cope with this propaganda policies of this government? We have nurses who are trained 3 and 4 years who are at home unemployed, and by this government, and now he is training people 4 months to take care of the sick. These politicians will go to South Africa, London, China for healthcare when they are sick. Why are they doing this? This is Ike. Okay, let me go to the next one. This man is saying they have posted everyone. That's not true. Well, he didn't say everyone. He said about 11,000, and I guess they are more than that. Tony, the messages are coming in so much that anytime I click, it just jumps. Let's see. This one says, please, how long did it take the MOH to employ the 11,000 nurses? This is Amate in Kaswa. Wants to know how long it took to employ them. Does Tony have documents to support his claim? He should produce them. This is Mahama in Kumase. This one says government can't continue to employ nurses each year. They should abolish this bonding policy, allow nurses to go into the open market and search for jobs themselves. Nana, please tell the PRO to stop doing propaganda with people's life. Which hospitals are they? Because I am working in a very big Shaik hospital, but I'm yet to see those nurses he's talking about. Anonymity. That's his name. Good evening, Nana. I completed last year, November 2015, and as it stands now, all those nurses who completed last year, November, are still in the house doing nothing. Tony, I'm going to give you the thing to read. I'm telling you. I want to know if the quota of applicants admitted at the private schools are directived from the government. If no, why should they compare themselves to government institutions? This is Gov't Kamben in Kenya. Say, let me get 2 more and then we go to the phones. No, this is not for us. It says, good evening, Nana. This new government policy will cause a huge brain drain at a point when we have 20 nurses to 1 patient, which shouldn't be the case. Hukash Muntari, Kete Krachi. Hey, say hello to Krachi Ra for me if you are in Krachi. And then this one, let me take the last one. Please, Nana, tell the Ministry of Health, PRO, that he shouldn't defend the indefensible. The problem came as a result of government not absolving those who had completed and yet went on to commission new health schools. I doubt if there can be a solution to this problem. Tony, if let me stop. I'll continue. I'll read you more of your messages later.
I can see clearly that most of the messages are coming from people who have no knowledge or less knowledge about what is happening in the health sector, actually.
So these are people who are home and desperate.
No, some you may not know. Some of them maybe, because I mentioned 11,000. I've mentioned 5,000, and it's currently happening. The 5,000 is currently happening. The 11,000 took place last year, I guess thereabout. It's happening. We even issued a press statement on the current job employment.
This idea that they are training they're doing some 4-month interim training. What's the?
I don't know about it. I don't know what he or she is talking about anyway.
Okay, it says rollout of job model 2016, recruitment of community health workers. The Youth Employment Agency, YEA, Ministry of Health and Labour Relationship, in collaboration with Ministry of Health, Ghana Health Services, and the IMCHW Global Campaigns, the World task to select community health workers will primarily perform home household visits, providing health education and promoting disease surveillance, malaria control activities. So basically they are, doing that.
Yeah, they are, no, community health worker is not a nurse.
No, but the nurses are trained to do that.
Community health worker is not a nurse.
No, but the nurses are trained to do this.
No, we currently, let me just explain that to you. We currently have community health workers in every community. Mostly when we are carrying out our campaigns, we have people who help us in terms of malaria campaigns. We have community workers. We call them social mobilizers in most of the communities. And this time around, Jeffrey Sachs' program is bringing on board some resources for us to bring these whole people together and give them some training, because they're already doing it already. So why not bring them together and give them the needed training and resource them for them to do what they've been doing already. So it's a different program altogether. We are not talking about nurses. If you're even talking about community health workers, health assistant trainees are not community health workers. We have community health nurse already, and most of them were employed to also complement what we are doing in the CHIPS program, the Community-Based Health Planning Services program. So this is a different program entirely. So they are not there to go and take care of people, no.
Selected community health workers will primarily perform home household visits, providing health education and promoting disease surveillance, malaria control activities, and support other community health activities with supervision of the community health officer within the CHIPS zone. They will undergo an extensive training in order to perform these tasks. So, Tony, if this is the case, are we to sort of give the private schools a quota so that you'll be able to absorb?
You see, I have said that we are requesting for financial clearance to employ them. Normally what happens is that we submit financial clearance, request for financial clearance to the Ministry of Finance. We've received the first badge for the 5,000 I mentioned. We are waiting for another badge. So immediately we get them, we'll start recruiting again.
Roughly how many nurses are out there to be absorbed?
Now what we do is that we receive the verified list from the Nursing and Midwifery Council. They will submit a list to us saying that these are nurses who have qualified as per our examination, and we verify them. So sealed, submit this for financial clearance. In the past, we were receiving it from the various agencies, and we had people who were not even nurses but were coming through the back door and we're employing them. So now we say before we employ you as a nurse, the council should submit a list. So we've received a list from the council in relation to the private and the degree nurses. We've submitted same to Ministry of Finance, waiting financial clearance, and we employ them.
But so the hospital need nurses?
Yeah, we need nurses to work with. This number of hospitals we are putting up and also expanding. If you don't have nurses, how do you operate them?
This one is from Sylvia. It says, please ask Mr. Goodman, the earlier posting done, midwives from Bolga Midwifery School who completed in 2014 were not posted. What's their faith? I don't know if you know about Midwifery School in Bolga.
I'm not aware of that.
You're not aware of that? So Sylvia, Tony is not.
So it means that she's just confirming that nurses have been posted, but they have not been posted. We'll find out.
Well, the issue, I think the issue is that, I mean, if I am home and somebody's been posted, I don't celebrate those who've got work. I need to mourn that I don't. Yeah,
I agree with you. But you cannot also.
But
post.
this
I have a figure.
This hasn't been an issue before. It just seems to be like this.
No, it's been there. You see, in the past, the way we recruit them, we recruit them in badges. That is what we are doing currently. But you also agree with me that the number coming out now, in the past we had just about 33 schools. In the past, now you have about 90 schools. And the number of
you are giving them the accreditation.
We have about, we don't give accreditation. Accreditation is given accreditation board. We don't do that.
But you give them these things to come and buy and sell. The Ministry of Health form and stuff.
One thing we have to also know is that Ministry of Health does not recruit. It's the agencies under the Ministry of Health that has the mandate to recruit. What we do in the Ministry of Health is to seek financial clearance for these agencies to employ. We give guidelines to those agencies. These are the number you can recruit this year. This is how many people you can post to this area. This is how many in terms of midwifery you can recruit. And then they will come with the names and then we'll go and seek for financial clearance for them. But because of this hula baloo, you have the ministry now taking charge of it, now regulating it, making sure that whoever is supposed to be employed is given employment. We have done that. That is the reason why we have this employment going on. We are still requesting for another batch to recruit the private and then the degree nurses. We are making sure that employment is given to every and anybody who deserves to be employed. That's what we are doing.
John, so now what are you going to do? I mean,
Nana, as Mr. Goodman said, he said the agencies are under them. As I said earlier on, per the sneaked policy, I don't know how to put it, either a sneaked policy or the decision by the government itself, to limit the posting of trained nurses.
I'm just trying to. Which one is the sneaked policy?
Sneaked policy is this, that you buy posting forms. The posting forms were clearly stated that it's for both public and private accredited trainers.
That doesn't mean that if you complete school, the day you are completed, you have to be employed.
Mr. Goodman, some of us have been in the house for 2 years. Some have been in the house for a year. Those who completed 2015, forms weren't even sold to them.
But you see, those who were trained by government have been employed. You have requested to be employed. We are taking steps to employ you. So that is why I'm not getting.
I would like to
You
ask,
said you want to be employed. We are seeking financial clearance to employ
Mr. Goodman,
you said we've sneaking policy.
I would like to ask whether the public trainees, the forms that they bought, is it different from this one?
Which forms?
The posting forms, the placement form, the permanent posting.
That I will not be able to say because, as I mentioned, we don't recruit.
It is the same thing. So we all apply.
So because I know people acquire forms, as whether they are sold, because I know in some agencies they will just give out the forms. Some agencies will say, okay, because you have to print, you have to bring some money. But for us, it is not something that is supposed to be sold. That we know. But because they need to also get some of this in bulk, so they request for some money from them. As I said, Ministry of Health has nothing to do with this particular stage. The stage we come in is where we are going to seek for financial clearance to engage them. So whatever happens at that level where they go acquire form and all that, we are not actually part of that process.
There's another question here from Beatrice that these things I have listed here are the duties of a nurse, which is the performing home and household visit, providing health education and promoting disease surveillance. They're the role of a nurse.
Which nurse?
Well, I don't know.
Community nurses, most of them do that. And even enrolled nurses and diploma
when
nurses,
you read this, they said they will support the community health nurse in a CHIPS compound. The document you just read.
Yeah.
He said they will support community health nurse in a CHIPS compound. These people are already in our communities. They're already there. They are working. But you need to give them knowledge to be able to do what they're already doing.
No, but what the nurse is saying that I've already been trained to educate people, do surveillance and everything. And
Which nurse? Which nurse?
Well, John is here.
No,
so
they are clinical.
Honorable.
We have category of nurses.
Yes.
He's a clinical person. If you go, you'll be in the ward. Those who are trained to do community education, do home visit and all that, are going to work with this particular group. The letter is saying that they will do that to support the community health worker in a church compound. You understand? So it's something, they're already there, they are doing it. Now we want to make sure that we harmonize the way they operate. We bring all of them under one umbrella. We give them some training, because at the end of the day, they will do it. So if you don't give them training, they will do it anyhow. So we are trying to give them training this time around to move them back into the community. They've been there before this. They are there with the people. They understand the pattern, the disease pattern in those communities. They are able to speak their language. They are able to convince them and tell them, please, you have to. When we went to Ethiopia, they said it's there. It's not a new thing in Ghana. It's something globally people are now doing. When you look at the Sustainable Development Goals, it's one of it, taking healthcare to the community, making sure that the community is part of whatever you are doing. So if you don't bring community on board, you'll be here in Accra thinking that you are providing healthcare to the people, but you are not touching lives there. So what we are doing, we are making sure that those in the community are part of whatever we are doing, and they are speaking the language we are speaking. They will not implement policy and go to the community and see people doing other things. We need to give them some education for them to do as expected.
You think the nurses are making maybe...
No.
They don't have...
As said earlier, because they've not been employed, they are looking for jobs, so they throw anything anyhow, trying to make sure that they win a lot of public sympathy. Fine. We are making sure that we get clearance and we employ them. But they should not attack programs of the ministry. They should not say that what the ministry is doing is not right. They should not also say that abolishing a policy and also introducing other means you are sneaking in policy, you are sneaking in programs. Those, no. The only thing you need now is job. So those are some of the things you should be talking about. But we are chastising anything, it means that you are not trying to be fair to the system you want to work in. But let's also not forget that these are people who were trained in private sector, and the way they got into the private sector is different from somebody who went into a publicly trained institution. I thought they
had the same.
And that's in those institutions, we have a clear guideline as to how the private.
No, but if you go there, then you say then that's why you're discriminating.
He will explain.
No. Let me explain. What we wanted the private schools to do is to train and retain some in the private hospitals. That you have arrangement with someone. When you go, the first private school, Holy Family in Teshi, that was arrangement. That you train parts, release some to government for posting, keep some in your hospital. Or private schools have some arrangement with most of the private hospitals in the country. After training, you send some to them, release the rest to government for reposting. So that is what the policy is. But because they overtrain, the number they train, you cannot also control it. We are in the ministry, that is not our mandate. It's the mandate of accreditation, but they give them accreditation to operate. We cannot go and be telling them that train this number. I remember we mentioned it at one of the meetings. I said, who said they are training them for you? Who said if somebody is going to a nursing school, is coming to work for you in the ministry of health? You clearly, you at times you understand them, because it doesn't mean that if I train you, I should give you a job. So at times you have little to do. You cannot go to private schools and say, please train 5 because I can only take 5. They are training. What is education? The meaning of education is to liberate the person from ignorance and for the person to also
that's
be
a
able
good point.
operate,
John, I'll come to you, but if I don't read this message, calling in Asingfusu will probably come through the screen and come and bash me. It says, good evening, Nana. Yes, it's true. Private nurses were part of last year's postings, but this shouldn't be a news. Why do I say this, Nana? The trend have always been such that all qualified nurses, both public and private, are being posted provided you have passed your licensing exam. All we are saying is that we won't rest until our group is being posted. They already have our list. They can post us. So they should please do justice to our case by engaging us. And this is Collins in Observer. He actually wanted to call into the show, but I've read your message for you. But I think nurses are a little bit peculiar. That the government is the biggest employer of nurses, and once a citizen trains to become a nurse, they have nowhere to go. But what he's saying is that if you've gone to private school, then you're on your own. But then the question then comes to, then why are you selling them forms?
He said something like, for the private institutions, they can't tell them that they should limit the number of people that they enroll, and they told them that they are trainees. They have a link with the private hospitals where some of them, some of their trainees will be at the private hospitals, then they will release the rest for the government to absorb. But he said it here that Ministry of Health doesn't give accreditation, but it's the National Accreditation Board that does that. Let me come to this one. We're saying that private accredited institutions, train more nurses as compared to the private sector. In the year 2014, the enrolled nurses exams, it was a government school who submitted the highest number of trainees, which was Narungu. They submitted 335. So if you hear, so 228. And the highest from the private side was Western Hill, which was 202. Understand? So both sides, being from the private and the public sector, they don't adhere to minimizing the number of trainees that you absorb or you train. They all go beyond the number that they are supposed to train. And with the issue that I am saying that it's a sneak policy, and Mr. Goodman was defending it. Here is the case. In the previous years, there was nothing like that. Look at this scenario. 2013, posting forms were sold to both public and private trainees. 2015, posting forms were sold to both public and private trainees. 2013, 2014, most of the private trainees are still in the house. I'm telling you, most of the private trainees are still in the house. That is one. And as he said, that the institutions are agencies under them. As I said here, that it is not only the Ghana Health Service, which is owned by the government, that absorbs nurses. CHAG is an agency too, I believe, which is under the Ministry of Health, but it is not owned by the government. And per whatever bond that the public trainees signed, that bond does not include the Christian Health Association of Ghana. They signed the bond with the government that when you are done, you are giving us allowance and all that stuff. So when we are done, you absorb us into your system. But here is the case that we private accredited trainees weren't given financial clearance. So an institution like CHAG, which comprises of mission hospitals like the churches, couldn't absorb us into their system. Hence, the government pushing public trainees to both the Ghana Health Service institutions and the Christian Health Associations. Is it not a sneak policy?
No, maybe you don't understand. CHAG institution all over the years have received nurses from the Ministry of Health. Maybe you don't know. CHAG is an agency of the Ministry of Health, like the Ghana Health Service. They are all agencies of the Ghana Ministry of Health. If we receive financial clearance from Ministry of Health for less than about 500 people, what we will do is that they are all our agencies, including the teaching hospitals. So it's okay, Kolebu, take 10, CHAG, take 10, Konfanoche, take 10, Cape Coast Teacher, take 10, Tamale. That's how we do it. So it goes to this institution, and then they will now do further distribution. So CHAG is part of us. They don't recruit on their own.
Is the agency CHAG an institution owned by the government?
I said they don't recruit on their own. They have an arrangement with government, which is wherever we have CHAG facility, government will not go and expand or put up a facility there. We renovate their facility, we add on. They are like government institutions. When you go to Holy Family in Brekume and all others, government have added onto those hospitals there. So that is the arrangement. They are providing services to the people of this country.
Let me read this message.
So make sure that we expand their infrastructure, we add on.
Matilda in Upper West, before she also comes and kills me here. I am a nurse trainee in one of the nursing training colleges. I would like the PRO to talk on student allowance and school fees. No allowance, but school fees are so high. Imagine paying school fees of 4,000 cedis with this economic hardship. The Ministry of Health is killing us. School fees are escalating, but no jobs available. Nana, the Ministry of Health is wasting resources on these community health workers. Community health nurses and community health officers are trained to do the work of our community health workers. Are you now taking the work of the community health nurse for people who are only 4 months trained? Let's face reality. Nana, stop the propaganda. Nana, how I wish this program was open and face-to-face. Please, we need more experienced persons to talk on this issue with facts and figures, not the guesswork Nana is doing. Matilda, I'm sorry. So now, Tony, what will come? Tony, what will come? But Matilda, I have your PRO here talking on your behalf now. So you were saying something.
Yeah. With the trainees who go to the private accredited institutions, there's nothing like how we enroll in the institutions are different. It is not different. There's something called indexing. When you enroll into a nursing institution, being private or public, your results, which is the WASI or SSE, are being forwarded to NMC, where they will also forward it to the WAEC for verifications. And NMC will confirm this, whether you duly qualify for the course that you are pursuing. And they will write back to you. And I would like to give you this for you to see, that you duly qualify for the course that you are pursuing, and you've been registered as a student nurse. You are now recognized by the Nurses and Midwifery Council as a student nurse, and you'll be taking or you'll be training in this institution. So there's nothing like private, those enrolling in the private institutions, their results or anything are different. There's nothing like that. It is the same thing. And the forms that you bought, it is the same thing that you bought with the public trainees. Here you state the institution that you went. So there's nothing different from the public.
On that note, let me take a quick break here, but let me put it on record that this is the highest, messages I've ever received, and the number of times people are trying to call the WhatsApp line, it's amazing. So Tony, I think
a lot of people are in the house.
There's a genuine concern of people at home who are desperate, but we're coming straight back. Don't move. Well, the show didn't end. We're still carrying on with the show. We just went on a break, and then we come back and we're still going on. There's actually another nurse behind, the camera, and she joined the show. And she joined it. Even the battery is dying on this thing. So this is literally a matter for concern. But the nation's heartbeat, the Ghana Premier League, shows every Saturday on your leading channel, Adom TV. For all the cheers, GSTS, suspense and thrills, don't miss the Never Say Die Accra Heart to Folk, the fabulous Kumasi Asante Kotoko, the mysterious Ebusia Drives, Secondly Hazakers, and the new kids on the block, Mediama Liberty Professionals, Brekum Chelsea, Techiman City, Wild Stars, New Dubiasi, and all other Premier Giants on your favorite channel, Adom TV, every Saturday. It's the Ghana Premier League, only on Adom TV. Yeah, what Aza Oye, and people still calling the WhatsApp line. I'm telling you, this is a big issue. Probably we need to come back and break it in segments and talk about it again. But left to rot, once again, the Edumasa Abakomahene has responded to his nation's call. Seth Kwame Boateng will join news in collaboration with Judicial Service and the Ghana Prison Service Council present Left to Rot, a sequel to Seth Kwame Boateng's Locked and Forgotten documentary on the state of Ghana prisons. Official premiere is at the auditorium of the new Judicial Court Complex in Accra. Date 22nd June 2016. Time 3 p.m. And this event is strictly by invitation. So if you want to go, take your pen and your paper and write. It's 024-314-9169. 024-314-9169. And they'll give you more information. The date is the 22nd of June. Seth Kwame Boateng, Abakomahene of Edumasa. Aren't we proud of our chief? Yes, we are. So the discussions continue, my brother. So there's no difference between being private or being government, and therefore there should be a fair quota in hiring. Tony, going forward, how do we solve this?
I have not tried to discriminate against them here. I was just trying to explain the difference between the private and then the public trained ones. That is what I sought to do. I would never discriminate against them because I have met them. The minister himself met them severally. We've told them clearly that we're trying to get financial clearance and then we'll engage them. When you look at what...
So this open to all policy now. So then how does it work? So everybody's now on their own.
Which one?
You know, now there's no bonding business. Yes. So whether government train or private train, so then the employment will now be...
That is what the private nurses even wanted. They said, let's open the field. Don't use the bond in giving somebody undue advantage over us. Scrap the bond and let's have a level playing ground. That is what we have now. And after this, all of them will come. Even before the bond, where they will all go buy form and then they are posted. So after the bond, it's still the same process. Nothing will change.
But how many are you able to absorb in a year?
Depending on your budget.
Averagely.
When you look at the number of nurses we have in the country itself, I think it's overwhelming. Currently we have about 81,000 and above nurses in nursing training colleges. And if somebody mentioned allowance, if we were to be given allowance, we would have been given 28 million and above. So clearly you would agree with me that most of the policies we're implementing in the past are outdated and we need to look at them clearly. That is where we are here now. Moving forward.
The 5,000, how many private nurses this last year?
No, this current one we didn't. I mentioned that the 11,000, most of them were recruited under that, and we had publicly trained nurses going to Flagstaff House to say that why did you post private ones? You have bond with us. Why did you? And we promise engaging them. Moving forward, we are going to engage everybody from there.
Okay.
Yeah.
So the 5,000, they were not private.
They were not part of it.
Okay.
Yeah.
And another comment.
Briefly.
Yes, we those that went to the Flagstaff House, it was public and private trained nurses. But here was the case that when the media men came, they overshadowed us and they were like, we are bonded, we are bonded, we are bonded. And that brought about the issue. But with 11,000, I tell you, the private trainees are very few. My batch, we completed school, it was only one girl who was posted from our class. So it is the private accredited private nurses who have been posted are very few.
Will this non-bonding open to all help the private? Will they help you?
It will, but what brought about the debonding, as Mr. Goodman said earlier and myself, you know, it was this bonding came about because of the allowance and the incentives there's no allowance. There's no need for you to bond trainees. So in as much as he's saying we want it, but there's no allowance. So there's no need for you to bond the trainee. Why else we are not giving him allowance? Bonding for.
Well. All too soon. That's what time would allow me. Guess what? The tablet just died with messages. There were tons and tons of messages. I want to say thank you for all those who sent the messages, and I just couldn't catch up with all the messages that were coming in, but indeed it's a matter that's of a national concern. I want to say thank you to Tantis, who makes me the shirts for the show, and currently they're doing 10% now. They're doing 10%, so if you want one of the nice shirts with 10%, especially if you're unemployed nurse, you definitely need a discount. 02023
no money to buy
0234 366 2001 0234 366 2001. Give them a call, get yourself a shirt. But to all the nurses out there, I say, are you cool? And keep the fight. Tony, thank you so much for coming. John, thank you.
Thank you, Nana.
Tomorrow we'll be back to do it all over again.
PM Express was brought to you by